Good morning, friends. Today, let us learn an Indian Express Press article explained: Are men more vulnerable to COVID? It's not so simple when race is factored in. A new study has found that societal backgrounds play a greater role in disease outcomes than gender does. Since the early stages of the pandemic, it has been clear that men are more vulnerable to COVID 19. They have fallen ill more frequently than women, and their death rates too have been higher. But a new study has found that societal backgrounds play a greater role in disease outcomes than gender does. The study carried out on men and women in two US states has been published in the Journal of General Internal Medicine. Like several previous studies, this one too found that men are more susceptible to COVID 19 than men, but within the same racial group. For example, black women were found to be up to 4 times more likely to die of COVID 19 than white men are. Black women are also 3 times more likely to die of COVID 19 than Asian American men are. Yet, black women were less susceptible than black men, white women less than white men, and Asian women less than Asian American men. The study looked at both genders for three racial groups: white, black, and Asian Pacific Islander. Across the six groups defined by both race and sex, black men were found to have highest COVID 19 mortality rates, up to 6 times higher than the rates among white men. These findings, the researchers said, strongly suggest that structural inequities in society are a principal factor in driving disparities in COVID 19 health outcomes across and between social groups. The researchers used statistics through late September 2020 from Georgia and Michigan, the only two US states that collected data tabulating age, race, and gender for all individual COVID 19 patients. Overall, they found similar patterns in both Georgia and Michigan. The authors cited limitations in the availability of data and the fact that Michigan listed both probable and confirmed deaths while Georgia listed only confirmed deaths. Also, there were examination of this data in relation to one variables such as occupation, state level politics, neighborhood characteristics, and socio-economic status is required to situate outcomes in interesting systems of power and operation. The study found that in Michigan, the mortality rate for black men was 1.7 times greater than the rate for black women. Among whites, the mortality rate was only 1.3 times greater for men than for women. That variation likely shows the relative importance of social inequities rather than biology. Thank you.